Good morning. It is the 28th of March 2021. A very, very happy Holi to you all. This is Dr. Deepak Natarajan, Chief of Cardiology, Supreme Hospital, Delhi NCR. The times are a bit awkward, to say the least. These are bizarre times. We have to look both at the selections in our cricket team as also the COVID situation in our country. Moeen Ali, the English spinner, bowled 10 overs and gave away 47 runs at an average of 4.7. As opposed to him, our spinner sends 10 overs, gives away 84 runs at an average of 8.4. The second Indian spinner sends across 6 overs and gives away 72 runs at an average of 12. Obviously, our spinners are not world standard. They may not even find a slot in the IPL. But they managed to make Ben Stokes look as a supreme batsman, which of course Stokes is a brilliant batsman, but he is not an extraordinary batsman. But our spinners ensured that he looked like one. Now this is a bit strange for me because arguably the best spinner in the world is right now languishing somewhere close to Marina Beach. This is the same person who had Ben Stokes bamboozled in the recently concluded test matches. So I find it a bit odd that this particular spinner, again I will repeat, who is considered to be the best spinner in the world right now, is not in the Indian team. And as opposed to him, we have these amateur bowlers who permit the English batsmen to run away at will. The second odd thing about the Indian team is that we have a so-called all-rounder who is not allowed to bowl because it seems that his body cannot take the workload. Now this I find very amusing because this chap is just about 30 years old, maybe 28 or maybe 32. Now that is a very young age, because at that age, let me look back, because when I was in college, I was I was actually the best long distance runner of the University of Delhi, as also the city of Delhi. This can be cross-checked if you scan newspapers of those times. I am talking about the 70s, or if you speak to some contemporaries of mine who would vouch that what I am saying is true. When I say that I was a long distance runner, this means that I was actually competing across 10 kilometers and possibly 14 and a half kilometers across country. So I know something about physical conditioning and I know something about physical fitness. So I find it hilarious that a young man who is considered an all-rounder is not permitted to bowl. And this is what happens if you don't bowl against this ferocious batting English lineup. You will land up in problems. There is no point scoring 330 runs or more than that, because the English batsmen can, we have seen, very easily cross that barrier. We are facing a battery of incredible batsmen. These are ferocious hitters of the white ball. We have Roy, Bairstow, Malan, Bell, Morgan, and of course Ben Stokes. So we need our best attack, which means that if you have a left arm pace bowler, if you have a left arm fast bowler, it makes sense to include him in the team. And then of course we go and bench possibly the best batsman in the Indian team in the first ODI. When you put him in the second ODI, we find that he scores I think 77 runs in 40 balls, as opposed to the apparently best batsman in the world, who scores 66 runs in 77 balls. Now I am talking about Rishabh Pant. You bench him in the first ODI. Pant is possibly the jewel, the ornament of the Indian team. This boy will go beyond Adam Gilchrist. He will go beyond Dhoni. There is no doubt about that as a wicketkeeper batsman. So I did not see any point in benching him in the first ODI. He is an incredible batsman. The more matches he plays across all formats, the better it is for him, and especially for the Indian team. Now this is very important. Now I've raised these points because we have a similar situation when we look at the COVID situation, right? The COVID situation is a bit bizarre, despite the fact that everyone is reporting that there is a surge in cases. we find that human behavior is getting worse. No common sense precautions are being adopted by the average Indian. Yesterday, I was in a small shop which was not exactly well ventilated. I was trying to buy milk and some bread. Comes in a young man who is about possibly 25 or 26. He stands barely 1 inch away from me. I can actually smell his breath because he's breathing down my neck. He has no mask. And I was wondering what's wrong with this country. We have these large political rallies. We have huge pilgrimages. And of course, now we will have these holy millings, despite the fact that cases are on the rise. Now, these cases are not on the rise because there is a variant or there is a deadly mutant. The cases are on the rise because we are just not behaving properly. We are not taking measures, the commonsensical measures, which have been advised the previous 12 months. Because of that, the cases are coming up. So therefore, it is very important that immediately common sense prevails, that the average Indian is told to wear masks, to avoid crowds, to maintain distance from his colleague or from his countrymen. There is no point rubbing shoulders in Holi and catching this virus. All right. Now, I will be specific now because I am ultimately an interventional cardiologist. I will talk about these two very nice papers. The first is published in The Lancet about 3 or 4 days back, and this tells us data from France. We have 2 provinces. We find that the data tells us that there was a fall in admissions of heart attacks to the tune of 25%. Now, this is a large number, and this data is echoed by other areas of the world. We find across the globe that heart attack victims were getting admitted much less than in previous years, to the tune of almost 25 to 30%. Now, this is a huge fall in the number of cases who are being admitted with heart attacks. This means that these people were suffering the heart attacks in their homes, and because of that, either there were deaths at homes or they were developing poor heart function and would eventually develop heart failure, which in itself is a very, very grim and serious situation. Now, what else does this data from France tell us? It also tells us that even though these patients came to the hospital, the mortality in the cath lab in the hospitals increased from 6% in previous years to 9%. So we have an increase of almost 35%. We have an increase of absolute 3%. Now, this again is a massive increase in mortality. The reasons they try to explain is possibly because these patients are coming late to hospitals. Now, it is a well-known fact that across all countries, people are terrified of this virus. They are scared, they are nervous of going to hospitals because they might contract the virus. Now, this is the wrong approach. I would urge you to tell your colleagues, your family members, your friends that in the event of a chest pain or any abnormal sensation or any breathing problem, it would be best that you go to a hospital to get yourself checked out. The other big study is published in JAMA, and this is a post hoc analysis of a large randomized study called the TOTAL trial. The TOTAL trial had included 11,000 patients of acute heart attacks, and they checked whether thrombosuction worked. Now, the promise of thrombosuction is based on the fact that just about every case of an acute heart attack, of an ST elevation myocardial infarction, is caused because the concerned artery, the concerned coronary artery, is blocked by a clot. Now, if you can remove that blood clot by a catheter, then it was presumed in previous years that you would help the heart in its recovery. But these big randomized trials like the TOTAL and TAPIS showed that really thrombosuction did not alter the clinical outcomes. But this post hoc analysis is important because this is telling us that the most important thing is the duration of symptoms. It is the time in which the patient concerned arrives in a hospital and undergoes a primary angioplasty with stenting. The longer that interval, the greater the delay, the greater the chances of mortality or developing cardiogenic shock or developing heart failure. So, we now link these two studies and we find that the French data is telling us that mortality has increased from 6 to 9% last year as opposed to previous years, and it is presumed, it is reasoned that this increase in mortality is because people were coming late into hospitals. And there is one more thing which I would like to add here, because my cath lab was the only cath lab, or just the only cath lab during the pandemic last year, during this time, which continued to operate. And I can speak with authority that I found my colleagues, the technicians and the nurses in the cath lab, a bit worried, a bit nervous. They were focused in protecting themselves, and which was quite natural, which was justified, but there was a slight compromise in their concentration regarding the patient of heart attack who was on the table. Now, because we did not know that the patient on the table had COVID-19, because there was no time to check, so we presumed that every patient on the table who came with a heart attack had COVID-19. So, one of the reasons of this increased mortality during COVID-19 in patients of a heart attack is that they come late. The second possibility is that COVID-19 itself, if these people are infected with the virus, may play a role. The third may be that across the world, the personnel in the cath labs may have been a bit jittery and may have been slightly nervous and may have been slightly focused. But of course, this is my personal opinion. This could be incorrect. This is a scope, an area for discussion and for debate. So I would now end this video by once again wishing you a very happy Holi. I would request you to press the like icon, the bell icon, and if you have a comment, please do put down your comments, and to subscribe to this channel and share this video with as many people as possible. Thank you very much.